every fever, every illness, every cold, every loose motion is not bacterial. And we should be very clearly understanding that if you have a running nose, if you have a little bit of headache, or you have bad throat, or you have body pains, you should not start taking an antibiotic just off the counters. It is most of the times viral, and viral illnesses will not respond to antibiotics, and they actually may make you worse. If you develop any dysentery secondary to the antibiotic, your disease actually primary problem may actually get worse. So simple diseases like most upper respiratory infections, especially if it is seasonal, like seasonal flu, doesn't require any antibiotic. It just needs rest, some paracetamol tablets, lots of fluids, take off from your work, stay at home, and the 2 days may you will start feeling better. Same with the diarrheal diseases. If you have just taken some outside food and you develop some little few 4 or 5 loose stools, you should not just go into and take an antibiotic just to stop that. Most of the times, good probiotics are enough to take care of this. You take probiotics, you take some symptomatic treatment for fever, maybe if your stomach pain, some symptomatic treatment for stomach pain. Diseases like dengue and chikungunya, many people start just taking antibiotics the moment they have a fever. Actually, they are not required when we are going through the dengue and chikungunya epidemic right now. And none of this respond to, they are both viral diseases. So you don't require antibiotics for dengue or chikungunya. Fever, severe body pains and severe headache possibly is dengue in the season. And you don't need to take any antibiotic, just take rest and consult your doctor and check some blood count, that's it.
And antibiotics are not like magic bullets. When you take antibiotic, there are side effects to it. When you're taking even a single antibiotic can change the gut flora. What we say, we have good bacteria and bad bacteria. So the good bacteria in your intestines can change. And lot of studies have come out where it has been seen that the moment the inside good bacteria die and your flora inside changes, there are other diseases which might come out. Like Dr. Rajib was telling about, there might be diarrheal or other side effects of the antibiotics. The second thing is, when you start antibiotics, diagnosis might become a challenge because you have already started antibiotics and you have not responded. Then you come to a hospital. It might become a challenge to diagnose because we will not know. Already you have suppressed that symptoms, already you have suppressed possibly whatever is causing the disease. So diagnosis also becomes a huge challenge. So it is important that if antibiotic is taken, there should be a prescription from a doctor that you have to these antibiotics. So see your doctor first. Consult a doctor first.
So never take antibiotics without a proper doctor's prescription, number one. Never take antibiotic just like taking some toffees, lozenges, or the ice creams that you go into the shop and take one. If you start an antibiotic under a prescription of doctor and the doctor prescribes this for 5 days, 7 days, you have to take the antibiotic 2 times or 3 times as per prescribed by the doctor for the prescribed dose, for the prescribed duration, and the timings to be maintained. Not that I take one in the morning, then skip the afternoon and take in the night. So that way we will long term, we may have an immediate response to the infection that you are treating, but in the long term your body will develop resistant bugs in your gut, and then when you really fall sick, none of the antibiotics which you regularly use will work, and you will have to be given very high end, very costly, very toxic antibiotics. So regular use of antibiotic makes you immune system weak. That has to be a message. Major immune system is your gut. Gut becomes weak, you fall prey to infections more commonly, and the infection that you fall prey to many times are resistant ones. So that's an important thing which you have to remember.
Thank you.
You.